I'm John Strum, and this is Real Talk MS. It's February 22nd, and we have a lot to talk about. We're going through an interesting and different phase of the COVID-19 pandemic, as we're beginning to see signs that COVID-19 may be transitioning from pandemic to endemic. At least that's what we're hearing from many of our local, state, and national leaders. But what does that mean if you're living with MS and you may be immunocompromised? How comfortable are you with the idea of being out in a world where everyone isn't fully vaccinated and mask mandates have been canceled? Last week, the chair of the MS Society's National Medical Advisory Committee, Dr. Nancy Sykott, joined me to discuss preventative treatments for COVID-19 that are available today for people who are living with MS, the importance of receiving 4 doses of the COVID-19 mRNA vaccines if you're living with MS, and some of the things we should be thinking about as we begin this transition from pandemic to endemic. This week, joining me to talk about how to manage your fear and anxiety, build your resilience, and deal with the emotional impact of living life in a world where COVID-19 is considered an endemic virus are Dr. Meghan Beier and Emily Reilly. Dr. Beier is an assistant professor of physical medicine and rehabilitation at Johns Hopkins University School of Medicine and a psychologist with specialized training in health psychology, neuropsychology, and multiple sclerosis. Emily Reilly is a certified personal trainer and a National MS Society staff member on the Advocacy and Healthcare Access team. Emily lives with MS, and we'll talk with her about how her life has been impacted by the pandemic and how she's found ways to cope with what I think you'll agree are some challenging but very familiar situations. But before we get to my conversation with Dr. Meghan Beier and Emily Reilly, there are a few other things that you should know about. This Thursday, February 24th, the ACTRES Forum gets underway in West Palm Beach, Florida. And that means that for the first time in nearly 2 years, I'll be traveling to West Palm Beach to attend an MS research conference in person. ACTRES is an acronym for the America's Committee for Treatment and Research in Multiple Sclerosis. And one of the things that sets this particular conference apart is that this conference adopts a specific area of research to focus on as its theme. And all of the presentations over the course of the 3-day conference are reflective of that theme. This year, the theme of the ACTRES Forum 2022 is biomarkers in MS. And as a quick refresher, a biomarker is a characteristic that can be objectively measured and evaluated as an indicator of normal or abnormal biological processes. For instance, if you go to your doctor because you're running a fever, your doctor might do a blood test. And if the results of the blood test indicate that your white cell count is high, your doctor will tell you that you have an infection. That high white cell count is a biomarker for infection. The ACTRES Forum begins with the Kenneth P. Johnson Memorial Lecture, an annual lecture named in honor of Dr. Kenneth P. Johnson, whose pioneering research on beta interferon led him to oversee the nationwide clinical trial for Copaxone, one of the earliest MS disease-modifying therapies. Dr. Johnson was awarded the Distel Prize for Multiple Sclerosis Research by the National MS Society and the American Academy of Neurology, and he founded the America's Committee for Treatment and Research in Multiple Sclerosis. Each year, the Kenneth P. Johnson Memorial Lecture kicks off the ACTRES Forum. This year, Dr. Ruth Ann Mary has the honor of delivering the Kenneth P. Johnson Memorial Lecture, and Dr. Mary will be speaking about comorbidities and MS. Dr. Mary joined me on the podcast just 2 weeks ago. And if you'd like to hear Dr. Mary discuss managing comorbidities and MS in a more informal setting, you might want to listen to episode 232 of Real Talk MS, and I'll include that link in today's show notes. As the ACTRES Forum gets underway, I'm looking forward to actually being face-to-face with so many people who I either haven't seen at all or only seen on screen for the past couple of years. I have to admit, it's been so long since I traveled, I had to give some real thought to what I needed to pack for this trip. But I'm looking forward to bringing you a bird's-eye view of the ACTRES Forum 2022 in the next episode of the podcast. Last week, the International Progressive MS Alliance released a strategic plan designed to guide their work over the next 3 years, through the year 2025. The plan begins very succinctly, stating the vision of the Alliance: to end MS progression. It then drills down, defining the impacts, priorities, and strategies that the Progressive MS Alliance will use in furthering its vision to accelerate the development of effective treatments for people with progressive multiple sclerosis to improve the quality of life worldwide. The Alliance identifies 3 priorities that will drive its research agenda: to understand, prevent, and reverse progression, to speed up and improve clinical trials, and to improve well-being through proven therapeutic approaches. The strategic plan also lays out the 4 strategies that the Alliance will rely on to achieve those priorities. Those strategies include broadening and deepening global collaboration, expanding investments and resources worldwide, engaging, inspiring, and mobilizing researchers, clinicians, pharmaceutical experts, donors, and people affected by MS. And finally, amplifying the voices and roles of people affected by MS. This strategic plan is a result of about 18 months of work by the Alliance Strategic Plan Development Work Group and multiple stakeholder groups. And I think they've done a remarkable job charting a course for the next 3 years. One of the things that makes this plan so much more than someone's wish list is the inclusion of the specific measures that the Alliance will use to hold themselves accountable to all of the ambitious goals outlined in the plan. To me, those specific measures transform this plan into a promise that can be relied upon. I'm looking forward to discussing this strategic plan in more detail in just a few weeks when Dr. Robert Fox, the new chair of the Progressive MS Alliance Scientific Steering Committee, is my guest on the podcast. Meanwhile, the International Progressive MS Alliance will be making their strategic plan available on their website at progressivemsalliance.org. And if you haven't yet spent some time on the Alliance website, well, now you have one more very good reason to visit. You'll find a link to the Progressive MS Alliance website in today's show notes. If you're a regular listener, then you've heard me talk about I Conquer MS before. I Conquer MS is a people-powered research network that provides you with the opportunity to be a part of MS research from the comfort and convenience of your own home. Right now, about 7,500 people affected by MS are already a part of I Conquer MS, and they're all adults, 21 years old and older. But now we know that MS also affects children and teens, so I Conquer MS is expanding its research network to include children and teens who are living with MS, as well as their parents. If you are or know of a child or teen living with MS, they can connect with I Conquer MS by completing an online survey. If you are or know of a parent or guardian of a child or teen who's living with MS, they can connect with I Conquer MS by completing a different online survey. And if you're a healthcare provider or researcher who's working with children or teens living with MS, you can also connect with I Conquer MS by completing still another short survey. And you'll find links to all 3 of these surveys in today's show notes. With all of the links that I'm including in today's show notes, it's probably a good idea to take a minute to talk about the show notes for Real Talk MS, because I've heard from some of you that you don't know where to find those show notes that I always reference in every podcast episode. Well, I create a set of show notes for each episode of Real Talk MS. The show notes include a summary of the things we talk about on every episode. They include the timestamps for each segment. So if you want to check a specific topic or listen to something again, you can fast forward right to it. I include all my contact information and social media links, so it's always easy to get in touch with me. And I include the links to everything we cover. So if I share the results of a clinical trial, you'll always be able to find that link and check out the details of that particular clinical trial. Or in this case, if I tell you about an online survey or another piece of online content, you'll always find a link right to that survey or content without having to spend time looking for it. If you're looking for the show notes for the current week's episode of Real Talk MS, you'll find them on the home page at realtalkms.com. And if you're looking for the show notes for a different episode of the podcast, visit realtalkms.com and click on Past Episodes on the menu that runs along the top of the page. Then click on whichever episode you happen to be interested in. You can also find show notes for Real Talk MS in some, but not all, podcast apps. Some apps just don't allow for show notes, and others allow for show notes, but they don't make the links live. They don't make them clickable. Regardless of how you listen to Real Talk MS or whichever platform you choose to use, you'll always find the show notes for every episode at realtalkms.com. The MS Society of the UK announced the return of its research grant program after having put it on hold due to the COVID-19 pandemic. The UK Society is investing $1.5 million to support 9 research programs. One of the programs involves developing an MRI technique that will measure how much myelin is in a person's brain. Another project involves studying the mechanisms underlying nerve loss in progressive MS. And another project will bring MS patients, caregivers, and clinicians together to develop a self-managed program for bowel symptoms. When we think about all the things that the pandemic brought to a halt, we should remember that with universities and laboratories closed for months or even longer, the world's research agenda fell behind. Unfortunately, that includes MS research. The good news is that as the world is reopening, scientists are back at their benches, progress continues, and new research is being funded and started. In this case, as in so many others, the logistical aspects of the pandemic are solving themselves. The human aspects of the pandemic are proving to be trickier. As the world goes back to work and play, our leaders are echoing everyone's hopes that the worst may be behind us and COVID-19 may become just one more endemic virus. But if you're living with MS, you may have some very different feelings about all of this. Some of you have already expressed to me a sense of feeling left behind because you don't feel very safe at work with colleagues who may be unvaccinated. And those situations can become even more challenging when we're considering friends and family members who no longer worry about masks or vaccinations. Living with that level of anxiety isn't healthy for anyone. And joining me in a moment to talk about ways you can mitigate some of that stress are Dr. Meghan Beier and Emily Reilly. The other day, I realized that we're entering the 3rd year of a pandemic that, at its start, we all hoped would somehow get cleared up in just a few weeks. The past 2 years have been different than any other time in any of our lives, and we've seen that for many people living with MS, navigating through the COVID-19 pandemic and its ever-changing landscape has created new emotional challenges. Returning to the podcast today to talk about how to manage these feelings and build resilience in the face of uncertainty is Dr. Meghan Beier. Dr. Beier is an assistant professor of physical medicine and rehabilitation at Johns Hopkins University School of Medicine and a psychologist with specialized training in health psychology, neuropsychology, and multiple sclerosis. Also joining me today is Emily Reilly. Emily is a certified personal trainer and a National MS Society staff member on the Advocacy and Healthcare Access team. Emily lives with MS, and she's here to talk about how she's learned to cope with all the stuff that the pandemic has thrown at us. Dr. Beier, Emily, welcome to the podcast.
Thank you so much for having us.
Dr. Beier, the pandemic hasn't been easy for anyone, but if you're living with MS, you've spent 2 years worrying about being more vulnerable to infection while trying to navigate the uncertainty of the pandemic. Clearly, that's created a lot of anxiety for a lot of people. How can someone recognize anxiety? And I'm hoping you'll share some strategies to manage anxiety and perhaps avoid having it feel like it's taking over your whole life.
Sure. So I think anxiety has kind of 3 different pieces to it. The first is the emotions. So that can include something like worry. It can be fear. It also has those thoughts that might be running through our minds, like, I can't do this anymore. This is too much. Why won't this just end? And it's also your body's reaction to those emotions and those thoughts. So it might be that your heart is racing, you're feeling clammy, your stomach is getting queasy. So the compilation of all of those is what we have under the umbrella of anxiety. So a good first step in terms of managing anxiety is being able to take an internal look at what's happening to us. What's going on in my mind? How is my body reacting? And if we can start to modify some of those things, like, this is really challenging, but I've made it this far, or just one day at a time. If we can change our thoughts a little bit, that can sort of turn the dial down on anxiety. Taking some deep breaths or using some relaxation strategies, even using apps like Calm or Headspace, are good ways to reduce our body's reaction. So I think those are some of those strategies. And if those strategies are not helping and these things are getting in the way of your everyday life and your relationships, then it's worth seeking out some extra guidance, whether that's from a mental health provider or places like the National MS Society that gives lots of really great tools and tips for anxiety management.
We know the COVID-19 vaccines are safe for people with MS, and the National MS Society recommends that everyone living with MS get fully vaccinated and boosted. But we also know that some disease-modifying therapies may make the vaccine less effective, which means that some people with MS may not be as protected against COVID-19 as others. So putting the biology and physiology aside for a moment, how is this situation emotionally affecting people?
Well, I think it's very natural that people are very uncertain and worried, and they have lots of questions. So I'm hearing from people a lot that they have lots of questions that maybe there's research and answers to, and maybe they kind of have to wait. And so there's uncertainty around that.
Can you tell us what resilience is and whether resilience is something that people are born with, or can resilience building skills be learned?
Resilience is your ability to bounce back in difficult times or after challenging times. So I think a lot of people with MS have been students of resilience for a long time. They've lived with uncertainty even from the moment that they had their first symptom. So using those skills can be really beneficial. There are some people who seem to have some extra skills around it. And maybe that's that they were coached on it as a kid, or their environment really encouraged resilience. And there are others that maybe didn't learn those skills earlier, but it's not an inborn skill. It's not something that you develop genetically. So they are definitely skills that you can learn, grow, and strengthen over time.
And why is resilience especially important today?
I think resilience is especially important because even outside of the pandemic, we all had a lot to deal with. And when you're living with MS for many years, you're dealing with new symptoms, you're dealing with having to manage doctor's appointments, people who don't really understand invisible symptoms. So you're already dealing with a lot and bouncing back from a lot. the pandemic adds this extra layer of stress, an extra layer of having to consciously think about decisions or relationships, or when is this going to end? Or what kinds of medications do I need to think about? Do I need to think about my DMT in a different way than I used to? So it's just a lot more conscious decision making. And that can bring about emotional fatigue, cognitive fatigue. And so resilience is especially important because we're just managing more than we used to.
Research has shown that many people are experiencing anger, and that pandemic anger, or panger, is real. People are frustrated that after 2 years, we're still dealing with the pandemic. There's also a lot of anger toward people who aren't following safety protocols and not getting vaccinated. How can people manage these feelings of anger, especially when so much of this seems out of their control?
I would start with acknowledging the feeling. So naming it and knowing that it's normal to have a little bit of some anger and frustration around this. I think the second step is to practice some skills of self-soothing. So, incorporating fun activities into everyday life, trying to take some rest breaks, staying connected to others, really sort of looking at our own values and how to live those out despite the pandemic. I think those are some quick tips for how to manage anger.
Emily, now that we're entering year 3 of the pandemic, how are you?
Yeah, to be honest, I feel weary and slightly discouraged. I think there was a part of me last spring when vaccines became available for the general public. And, I had a lot of faith that people would choose to not only protect themselves, but those around them. And sadly, that wasn't really the case. And at the same time, I really felt, confident and empowered to know that I could make a decision that would help protect me, like getting vaccinated and continuing to wear a mask, and that somehow I was somewhat in the clear and maybe I had a false sense of security. But as we've learned over the past, couple of years, that the impact that some disease modifying therapies have on the effectiveness of vaccines, I think that sense of security was somewhat diminished. I actually did end up getting COVID at the end of last year. And that was really scary and frustrating because I did everything, to keep me safe. But thankfully, with the guidance of the National MS Society and my neurologist, I was able to get access to those monoclonal antibodies that really helped me recover quicker from COVID, but I really don't want to get it again. And so knowing that I'm still at risk, despite everything that I can do to keep myself safe, really keeps me on this heightened sense of fear and anxiety, and also frustrated of when am I going to feel safe again? I like the term pangry because that really resonates with me.
So tell me, how has your experience over the past couple of years differed from your friends or family members who don't have MS?
Yeah, most of my friends and family, they don't live with MS. And so they really will never understand what I deal with on a daily basis. And that goes with those symptoms that I experience to just the fear and anxieties that I've been experiencing throughout the pandemic, and just that inherent risk that I currently have with the disease modifying therapy that I am on. They just don't understand that. And so I think the fact that our perspectives are different make understanding one another a lot more challenging. I think that this is where I really have to practice grace and try to communicate as clearly as possible with those around me how I'm feeling. But to tell you the truth, that has not gone well in some cases, and my emotions and my frustrations really got the best of me. I guess I think my hope was that those closest around me would make choices, would want to help keep me safe. And when their choices tell me otherwise, it's just really hard for my heart to understand that.
Well, now that we're at a point in time when the pandemic may become endemic, what are your feelings about living life in a post-pandemic world where you may not be as protected as others? How do you feel about going back to work or participating in in-person activities, or really anything that we used to call normal everyday life?
Yeah, it's challenging because these last 2 years, I've been a little bit more anxious and fearful, and I miss the interactions. I'm a super social person and I miss those social interactions, but still with that fear of like, am I safe? And with the changes in current mandates, like masks not being required or vaccines being required, it adds a little bit more fear. But I'm really, really thankful for healthcare professionals like Dr. Beier, who have really helped me throughout this pandemic, who've helped me navigate some of those feelings. And so I encourage anyone who may be struggling with some of those things to seek out a mental health professional to help navigate them, because that has been really helpful. And as I prepare to go back into the office, I use public transportation, and I think it's just this constant evaluation of risk. We all have a different risk threshold. And so it's just going to be something I'll continue to evaluate and talk with my doctor about. But I kind of also think like, okay, I've had MS for 16 years, and how have I dealt with, dealing with all the different things that I come across? And, I feel empowered knowing that I have choices to make to help control or manage my disease. And that includes like staying on a disease modifying therapy and taking the proper precautions, like getting vaccines or flu shots, or even just staying physically active has been helpful throughout this pandemic, of like not being sedentary and help boosting my mood. And so I just hope that also helps people feel empowered, knowing that we have a little bit of control in this uncertain disease. So I guess I'm cautiously optimistic as we move forward.
Many people living with MS have been surprised to find some of their friends and even family members aren't vaccinated. And Emily, you sort of alluded to having experienced that firsthand. So I want to circle back to that with you and ask you about what had to be challenging, awkward, even conversations you've had to have with people close to you. How did those conversations make you feel? And what is it that you want your family and friends to know?
Yeah, well, I wish I had some of the tips and tricks that Dr. Beier had mentioned on how to have, maybe better conversations, because some of the conversations I've had have been really challenging with close friends that really left me feeling discouraged and at a loss on how to move forward. It's challenging when there are people in my life who choose not to get vaccinated or even wear a mask. And so I'm kind of left to make really hard decisions. Like, is it safe for me to be around them? Or when I go to church and the majority of people aren't wearing masks, am I willing to compromise my health so I don't feel awkward or like I stand out? And so at the end of the day, I guess I have to recognize that I'm still at risk of getting COVID again. And I want to be wise and mitigate those risks as much as possible. So though it might feel embarrassing or awkward, I just want to continue to do the things that keep me safe so that I can be a part of the things that do bring me joy. And so I guess I would just love for friends and family members, not only myself or just the public in general, just to really consider those things and our feelings, and hopefully we can, make decisions together so that we can continue moving to like doing life together, but in a way that we both feel comfortable. So just having those honest conversations, which are really hard.
They are. So I'm going to ask you, Dr. Beier, to share some ways for someone with MS to approach these conversations about vaccination and safety protocols with their loved ones.
Yeah, absolutely. And I just want to highlight that what Emily shared is so true. And many people are really feeling that frustration. And these conversations are really hard and they're vulnerable. And they trigger lots of emotions in us and others. So the first thing I would say is I want to start with thinking about how to soothe ourselves. So that might be taking some deep breaths even before we start the conversation or throughout it. Asking to take a break from the conversation. If you find yourself not able to think straight or that you're seeing red, that's a good sign to take a break in the middle of the conversation. I think also starting with really understanding the perspective of others, and we don't even have to agree with it. And many times we won't, but if we can really start to ask questions and get curious about why they feel that way, or even understanding if there are any emotions that we can align on. So, thinking about my own perspective and conversations I've had that have been uncomfortable, many people feel like this has been frustrating. This has lasted for too long. All of us maybe can align on those feelings, even if we come at them from different perspectives. So if we can sort of build some inroads or some points of connection and then ask to share. So you're really hearing what the other person is saying, you're acknowledging it, you're listening to them, that makes them feel heard. Then you ask to share your own perspective. So when we listen to others, they're more likely to listen to us. And by gathering those points of connection, we're really turning the conversation towards empathy rather than getting into an argument. So then you ask for permission. Can I share my perspective? Sometimes people with MS have cognitive challenges or are easily triggered emotionally more easily than maybe people without MS. So I often tell people to take notes in a conversation so that you can come back to points later that you might forget if you're feeling emotional. This also gives you a little bit of space so you're not just internally screaming. So taking notes in the midst of a conversation can be really helpful. If people are not willing to hear your perspective, even if you've tried to do it in a calm, empathetic way, I think it's okay to start thinking about what boundaries are important and necessary for you.
Emily Reilly and Dr. Meghan Beier, thank you for all you both do to improve the quality of life for people living with MS. And thanks for talking with me today.
Thank you so much for having us.
That's going to wrap up this episode of Real Talk MS. Real Talk MS is powered by the National MS Society. And you can share this episode of the podcast by letting your friends or family members know that all they have to do is point their web browser at realtalkms.com/234. You'll find that link in today's show notes so you can easily copy and paste it right into an email or text. If you have a minute, I hope you'll visit the Apple App Store or the Google Play Store and download the free Real Talk MS app for your iOS or Android smartphone or tablet. It's the best way for us to stay connected. The app will automatically download the latest episode of Real Talk MS. You'll be able to access any of our past episodes. You'll be able to save your favorite episodes. And it's a great way for me to share bonus content with you. The app is free, so I hope you'll download it today. I'm John Strum. Thanks for listening. Stay safe and make healthy choices.